Your mom caught herself on the kitchen counter last Tuesday. Your dad grabbed the handrail a little too hard coming down the stairs last week. You saw it. You mentioned it. And then life moved on. Maybe you even said it out loud. Oh, that's just age. I need you to stop right there. Because that one sentence, well-meaning as it is the mistake I'm talking about today. And by the end of this video, you're going to understand exactly why it matters, what it actually means when an older adult trips or stumbles, and most importantly, what you can change this week to prevent something catastrophic. Falls are the #1 cause of injury death in adults over 65 in the United States. But here's what nobody tells families. A fall doesn't start the moment someone hits the floor. It starts weeks, sometimes months earlier, in ways that look nothing like falling. Today I'm going to show you what those early signs look like and what your family needs to do about them before something irreversible happens. Here's the mistake most families make. They treat falls as accidents, an icy patch, a rug that shifted, a moment of bad luck. And sometimes, yes, environmental hazards play a role. But what I see over and over again in clinical practice is this. The environment didn't fail your parent. The body gave signals for weeks that something was changing, and no one knew what to look for. There's a concept in geriatric medicine called fall risk accumulation. It means that small, invisible physiological changes stack up over time in muscle strength, in balance, in medication load, in vision, until a completely ordinary moment becomes dangerous. Reaching for a glass on a high shelf, turning around quickly in the kitchen, getting up from the couch in the middle of the night. These aren't freak accidents. They're the predictable result of unaddressed warning signs. And the reason families miss them, the reason I'm making this video, is that the warning signs look like completely normal aging, slower pace, a little more cautious on stairs, less steady in the morning. Normal, right? Not always. And today I want to give you the clinical lens that changes how you see these moments, so you can act on them instead of moving on. Point 1. Gait change is the first warning sign, and families almost always miss it. I want you to think about how your parent walks right now and compare it to how they walked 2 or 3 years ago. Is there shuffling instead of lifting the feet? Are their steps shorter? Do they walk slower with a wider stance? Are their arms not swinging naturally at their sides? These aren't stylistic changes. These are measurable clinical indicators that predict fall risk in research studies. They represent changes in neuromuscular control, balance, confidence, and strength that can be assessed and critically addressed. Here's what I want you to do the next time you're walking with your parent to the car through a parking lot at a family event. Pay attention. Not with alarm, just with awareness. Is the way they move today different from what you remember? If yes, that observation is worth a conversation with their doctor. You can say exactly this. I've noticed their walk seems different lately. Can we talk about fall risk? That single sentence can open a door to physical therapy, balance training, and early intervention that makes a real difference. Point 2. Polypharmacy, the invisible tripwire in the medicine cabinet. If your parent takes 4 or more medications, and the average American over 65 takes between 5 and 9, their fall risk is measurably elevated, not because any one medication is dangerous, but because of how they interact with each other and how the aging body processes them. Blood pressure medications can cause a sudden drop in blood pressure when standing up, called orthostatic hypotension, that leads to dizziness, near fainting, and falls. Sleep aids and antihistamines, including over-the-counter ones, cause sedation and slowed reaction time that persists into the following day. Certain antidepressants and muscle relaxants affect coordination and balance. The problem isn't usually one medication. It's the combined load and the fact that nobody is looking at all of them together. Here's what I want your family to do. Make a complete medication list. Every prescription, every supplement, every vitamin, every over-the-counter drug. And then ask for a pharmacist medication review, specifically requesting that they flag anything that may affect balance, blood pressure, or alertness. This is free in most pharmacies. It takes about 30 minutes, and it has the potential to identify risks that no single prescribing doctor has ever seen all at once. Point 3. Vision changes that nobody mentions at eye appointments. Here's one that surprises families. Vision changes are a direct, significant fall risk factor, and the changes most relevant to falling are often not the ones being addressed. Most older adults get their glasses prescription updated. What often doesn't get assessed is depth perception, the ability to judge distance and height accurately, which is critical for navigating stairs. Peripheral vision, the side-to-side awareness that catches unexpected obstacles. Contrast sensitivity, the ability to distinguish a step edge from a flat surface in low light. And bifocals, which many older adults wear, actually distort depth perception when looking down at stairs because the reading portion of the lens is in the line of sight. Many falls on stairs happen precisely because of this. When was your parents' last full vision evaluation? Not just a prescription check, a comprehensive exam including depth perception and peripheral vision? If it's been more than a year, this is worth scheduling now. And when you call, mention specifically that you want fall risk factors assessed. That framing will change the focus of the appointment. Point 4. Fear of falling creates falling, and families often make it worse. This one is counterintuitive, and it's important for families to understand. When an older adult has a fall, or even a near miss, it is extremely common for them to develop a fear of falling, and the instinct that follows feels logical. Move less, be more careful, stay seated, stick to what feels safe. But that instinct, acted on over time, is dangerous. Reduced movement leads to muscle loss. Muscle loss leads to worse balance. Worse balance leads to greater fall risk. The fear of falling in this way actually causes the falls it's trying to prevent. And here's where families sometimes make it worse without realizing it, by accommodating, bringing everything to the older adult so they don't have to get up, doing tasks that the person could still do safely with some support, removing challenges in the name of safety. What the research shows is different, gentle, structured movement, chair-based exercises, walking programs, Tai Chi, rebuilds the neuromuscular confidence that makes the body steady. The goal is not to remove challenge. It's to build the capacity to meet it. If your parent has started avoiding activity to be safe, that avoidance is itself a clinical risk. It deserves a conversation and a referral to physical therapy for balance-specific training. Point 5. The bathroom, the most dangerous room in the house and the easiest to fix. If there's one thing I want every family watching this video to do today, one concrete, immediate action. It is this: assess the bathroom. Over 80% of home falls in older adults happen in the bathroom or on the way to the bathroom at night. The combination of factors that converge in that room is almost a perfect storm. Wet or slippery surfaces, no structural support to hold, nighttime disorientation, urgency that causes rushing, and the transition from a warmer bed to a cold floor that affects blood pressure and alertness. Walk into your parents' bathroom tonight and ask these questions. Is there a grab bar next to the toilet? Not a towel rail, an actual wall-anchored grab bar, rated for body weight. Is there a grab bar in the shower or bath? Is there a non-slip mat both inside and outside? Is the path from the bed to the bathroom lit at night? Not overhead lights, those are disorienting, but night lights at floor level that illuminate the path without requiring full visual adjustment. A grab bar costs between $20 and $40. Professional installation takes under an hour. This is potentially the most important home modification your family can make, and most families wait until after a fall to make it. Don't wait. I want to be honest with you about what's at stake, because I think families deserve the complete picture. A single fall, even one without a serious fracture, often triggers what geriatricians call the downward spiral. Fear of falling increases. Activity decreases. Muscle loss accelerates. Balance worsens. The risk of the next fall and the next compounds. For families, there's a specific number worth knowing. One hospitalization after a fall is the most commonly cited trigger for a permanent move to assisted living. Not always because the injury demands it, but because the confidence is shattered for the older adult and for the family. And here's the cognitive dimension that doesn't get discussed enough. Older adults who experience falls have significantly higher rates of depression, social isolation, and accelerated cognitive decline in the years that follow. This isn't a coincidence. Loss of mobility, loss of confidence, loss of community participation. They have measurable effects on the brain. I'm not telling you this to frighten you. I'm telling you this so that the actions I'm about to give you feel proportionate to the risk, because they are. Today, do a bathroom audit. Check for grab bars next to the toilet and in the shower. Check for non-slip mats that are secure and not sliding. Install night lights on the path from bedroom to bathroom. This week, compile a complete medication list, every prescription, supplement, and over-the-counter drug, and request a pharmacist medication review. Ask specifically about fall risk side effects. Also this week, schedule a comprehensive eye exam. When you call, tell them you're concerned about fall risk factors, including depth perception and peripheral vision. This month, ask the primary care doctor to perform a formal fall risk assessment. Ask specifically about a physical therapy referral for balance training. Mention any gait changes you've observed. Ongoing, encourage 20 to 30 minutes of walking daily. Introduce chair-based leg strengthening exercises. Research local Tai Chi classes for older adults. This has the strongest evidence base of any exercise intervention for fall prevention. If someone in your life stumbled last week and said, "I'm fine," please do not leave this video and move on as if nothing happened. The body was communicating something. Now you know how to listen. These are not complicated interventions. A grab bar, a medication review, an eye appointment, a conversation with a doctor. These are achievable this week. And I want to say one more thing to the families watching. The fact that you're here, learning this, thinking about this, that matters. That is exactly the kind of attention that makes a difference. Not in a dramatic crisis moment, but on a quiet, ordinary Tuesday. If this video helped you, share it with someone who needs it. A sibling who isn't sure what to watch for. A friend who's in the same situation with their parent. Because the information is only as valuable as the conversation it starts.